What is CSF, cerebrospinal fluid, used for in Ms. diagnosis? Imagine a clear, protective cushion surrounding your brain and spinal cord. That's cerebrospinal fluid, or CSF. It's vital for nourishing and protecting your central nervous system. When doctors suspect multiple sclerosis, they often look at this fluid for clues. A lumbar puncture, also called a spinal tap, is the main way to collect CSF. During this procedure, a doctor inserts a thin needle into the lower back to draw out a small amount of fluid. It might feel a bit uncomfortable, and you could get a temporary headache afterward, but it's a safe and important step in diagnosing Ms. Once the CSF is collected, it is analyzed in a lab. One of the key things doctors look for is the presence of oligoclonal bands. These are specific proteins produced by the immune system. In most people with multiple sclerosis, these bands are found in the CSF but are either absent or much less common in the blood. This pattern suggests that immune activity is happening within the central nervous system itself, which is a hallmark of Ms. The analysis can also measure other markers, like free light chains. These are molecules that can indicate immune system activation and help support the diagnosis. But it's important to remember that CSF analysis alone cannot confirm multiple sclerosis. It must be combined with other diagnostic tools, such as clinical examination and magnetic resonance imaging scans. Doctors use CSF testing to gather more evidence when diagnosing Ms., especially when symptoms are unclear. The presence of oligoclonal bands and other markers can help distinguish Ms. from other neurological conditions. However, because individual experiences vary, no single test can definitively diagnose Ms. without considering the full clinical picture. If you or someone you know is undergoing evaluation for Ms., it's essential to work closely with healthcare professionals. They will interpret CSF results along with other tests to arrive at the most accurate diagnosis. Remember, each case is unique, and diagnosis involves a comprehensive approach to ensure the best care.